Hello everyone. I will be talking about angiography, ventriculography, electroencephalography, echo-encephalography, computed tomography, magnetic resonance imaging, indication for use, diagnostic capabilities. Angiography is a minimally invasive medical test that use X-ray and iodine containing contrast material to produce picture of blood vessels in the brain. In cerebral angiography, a thin plastic tube called catheter is inserted into an artery in the leg or arm through a small incision in the skin to detect or confirm abnormalities within the blood vessels in the brain, including an aneurysm, a bulge or sac that develops in an artery due to weakness of arterial wall, atherosclerosis, a narrowing of the arteries, arteriovenous malformation, a tangle of dilated blood vessels that distribute the normal blood flow in the brain, vasculitis, and inflammation of blood vessels, generally narrowing them, a brain tumor, a blood clot, a tear in the wall of an artery known as a vascular dissection, a stroke. Ventriculography to indicate any intracranial neoplasm which is of sufficient size to produce an increase in intracranial tension will cause variation in the position or size and shape of the ventricular system. Ventriculography consists in the removal of the cerebrospinal fluid from the ventricles. The fluid is replaced by air. Air is much more permeable to X-ray than is bone. So the air shadow offer a marked contrast to that cast on the röntgenogram by the skull. In this way, changes in the normal configuration of the ventricle are made apparent. From this distribution in the ventricle outline, a clear conception may be obtained of the position of the tumor which produced them. Electroencephalography, an EEG, is a test that detects abnormalities in the brain waves or in the electrical activity of the brain during the procedure. Electrodes consisting of small metal discs with thin wires are busted into the scalp. The electrodes detect tiny electrical charges that result from the activity of your brain cell. The charges are amplified and appear as a graph on a computer screen or as a recording that may be printed out on paper, may be indicated to evaluate recurrent seizure activity, present altered level of consciousness, or altered mental status following eclampsia. The EEG may reveal epileptiform activity. Echoencephalography, the use of ultrasound to examine and measure internal structure, as the ventricle of skull and to diagnose abnormalities and disease. Echoencephalography is used by physicians in the diagnosis of the following disease: ischemic stroke, cerebral ischemia, vertebropatellar insufficiency with vertigo septum, somatoform disorder, autonomic dysfunction, transient ischemic attack, dizziness, tinnitus, intracranial pressure, headache, confusion and brain contusion, neck injuries, and cervical cranial syndrome, encephalopathy, Parkinson's disease, hypophyseal adenoma. Computed tomography. A computed tomography scan is a medical diagnostic procedure that combines nuclear radiation and X-ray technologies to create high details image of the body, rapidly diagnosing a stroke and pinpointing the location of blood clot or aneurysm that could have caused it. Detecting damage to the brain or skull that comes from a head injury. Assessing the size, shape, and location of brain tumor, and identifying the location of a potentially fatal brain aneurysm. Monitoring the advancement of progressive disease like multiple sclerosis, Parkinson's disease, and other neurological disorders. Providing clear, detailed image of the brain cavity, which is important when a patient has hydrocephalus. Magnetic resonance imaging. MRI is a diagnostic imaging technology that gives physicians a dilated picture of a part of body, hypoxia in encephalopathy, dysfunction of a brain due to a lack of oxygen, encephalomyelitis, inflammation, infection of a brain and or spinal cord, herniated or degenerated disc of the spinal cord, malformation of vein or and or arteries of the brain and or spinal cord, hemorrhage or bleeding into the brain or spinal cord, subdural hematoma, bleeding just under the brain's protective covering. Thank you for your attention.
Okay. Значит, I want told you about the meningitis because meningitis is the tomorrow exercises. And you read my lection after the reconnect. Please reconnect our Zoom. And да, Ольга Николаевна, да, слушаю.